So now we have Brianna Brohm. And so Brianna is a MSW candidate at Laurentian University and a customer care representative with Workplace Safety North, WSN, in Sudbury. Her research focuses on Ontario mine rescue personnel's experiences of critical incident exposure and post-incident supports with a broader interest in workplace mental health and psychological health and safety. And so today, from idea to implementation, developing a worker-centered study on critical incident supports for mine rescue personnel. Whenever you're ready, Brianna.
All right. Well, thanks for having me today, and thanks for the introduction, Dr. Goggins. So, today I'm going to be sharing my research project, which is focused on Ontario mine rescue personnel and post-critical incident supports. So, I'm looking at what the perception and experience of post-critical incident supports are in the lens of mine rescue personnel. So, what is it that they actually find helpful after an incident, and then what can be improved? So, if you only remember one thing from my talk today, I hope that it's this, that good post-incident support isn't just having programs on paper, it's really about centering Ontario Mine Rescue personnel as the experts. And this is going to include determining what supports they feel are helpful after a critical incident, what gets in the way, and what they think should change. So today's presentation, it's just going to cover two things really, and it's one, why this topic matters for mine rescue personnel, and two, how the study is designed to produce practical, useful recommendations from the lens of these first responders that I have the utmost respect for. And then just to define what I mean by post-critical incident supports, I'm really referring to both formal and informal supports people might access after a critical incident. So this could be, the employee and family assistance programs, it could be peer support, debriefing practices, and it could also include personal support through family and friends, and then really just how the organization is following up afterwards. So before I jump in, I just want to kind of give a quick little roadmap as to where we're going to go today. So first, we'll start with the context, which is just essentially going to provide a brief overview of Ontario Mine Rescue. I really want to discuss the roles that these personnel carry and then how they came to exist. And then second, I'm going to outline the problem, which is that there is no research capturing Ontario Mine Rescue personnel's perspective on post-incident support. So, engaging in mine rescue work can involve exposure to distressing events. And while supports do exist, we really don't have research on how these supports are actually landing with these personnel. Then I'll move into the purpose and significance, explaining the frameworks and the study design. And that's really just to kind of go over the lenses that are guiding the study. And then I'm going to discuss how the study is structured. Then I'll wrap up with next steps, which is including recruitment. It's going to include interviews, analysis, and then I'm going to talk about how the results are going to be shared back in a useful way. And because we're still recruiting, I can explain afterwards, who can participate and then also how you can reach me. So, to understand the why behind the study, it really does help to start with the origin story. So, in 1928, there was a devastating underground fire at the Hollinger mine in Timmins, Ontario, and there 39 miners actually tragically lost their lives. And at that time, Ontario simply, they did not have the training, they didn't have the equipment, nor did they have the coordinated emergency response capacity to really manage an event like that in a safe and effective manner. So in this specific case, Pittsburgh mine rescue teams were called to extinguish the fire, and then the responsibility for body recovery operations was delegated to mine management. And that tragedy really did become a turning point. And in 1929, Ontario Mine Rescue was established, and it's been operating since that time. So in the early days, Mine Rescue, it was about training volunteers to operate breathing apparatuses, practice rescue techniques, and then also how to respond as a team under pressure. But Over time, what we've seen is that has evolved into this province-wide model that we're actually seeing today with regular training and standardized practices. So when we're looking at mine rescue, it's not just about showing up when something happens. It's really that ongoing practice, that teamwork, where these personnel are learning equipment, they're learning communication, problem solving, and then when an emergency does transpire, people are prepared, right? And their work is quite extensive. It can involve fires, entrapment, fatalities, severe injuries, and high risk situations. And they really do possess a unique set of technical skills as well as occupational responsibilities that are really reflected in their training. So they have tons of training. They have training in specialized breathing apparatuses, advanced medical responder first aid, basic life support, advanced cardiac support, rope, firefighting, structural collapse, vehicle entrapment, and confined space training. And today, Ontario Mine Rescue relies on a large network of both trained volunteers as well as trained officers. So, just really looking at these roles and responsibilities of officers, for instance, they're responsible for training volunteers in effective emergency response, but then they're also responsible for ensuring the maintenance and the deployment of emergency response equipment all throughout the province of Ontario. And then, in the event of a mine emergency, per se, these officers are usually going to take a position to guide the teams and guarantee their adherence to the established training protocols and policies. But there's actually times where these officers are actually dispatched to the emergency scene. And really, here, what I really want to focus on is the part that makes mine rescue work very different. It's that these emergency responses can happen in the same workplace where they are working their regular job. And then sometimes the people that are involved in these emergencies can be coworkers, it can be friends, and it can be community members. And we really know by research that incidents that are involving someone known to a rescuer, it can make it really challenging for them to fulfill the role of a first responder. So when we're looking at the roles and responsibilities, it's really important that we understand that these first responders are responding to extremely high risk situations. And we know that even when a response is successful, that experience can stay with a person. So it's really not just about that physical intensity that we're seeing in their roles. There's also that emotional and psychological impact too. And I think for myself, that's why this research really, really matters to me. Ontario Mine Rescue, it's built to protect life underground, right? But I think with this study specifically, we're asking, okay, well, how well are we protecting the people who do that protecting after the incident is over? So, mine rescue work can involve exposure to potentially psychologically traumatic events. And that is basically events that can have a lasting emotional impact. So, we've previously discussed the roles and responsibilities, but going back to what we discussed, right? Those entrapments, those fires, those fatalities, those are all examples of a potentially psychologically traumatic event. And when we look at broader first responder literature, we know that repeated exposure can increase risk for distress-related outcomes, but it's also important to note not everyone's going to respond in the same way, right? And also, not all distress is pathological. In Ontario Mine Rescue, supports can exist through formal options like family employee assistance programs. Again, we discussed those debriefing approaches, the peer support, but there's also those informal supports as well, like family, friends, and coworkers. But we have a key gap here, and that key gap is that we don't yet have any research describing what mine rescue personnel themselves think about these supports. So really, we don't know what feels helpful, what doesn't, what barriers exist. What would they change if they could? So, really, that specific objective of this study is to kind of contribute to a better understanding of these critical incident supports, but in the lens of the mine rescue personnel themselves. So, going back here to the purpose of the study, it's really to explore Ontario Mine Rescue personnel's experiences as well as perceptions of post-critical incident supports. And this study is guided by two questions. One being, what are the experiences and perceptions of Ontario Mine Rescue volunteers and staff towards post-critical incident supports? And then also, two, what improvements can be made to better support the needs of Ontario mine rescue personnel following critical incident exposure? But there is one important boundary that I really want to note for this study is that we're not collecting detailed critical incident stories. The focus is really on the after. So we're really curious about what do people actually do after an incident? What support feels safe to access? What barriers exist, and what changes would really make a difference. Because the intent here is really to generate some practical, context-specific recommendations, but those have to be grounded in qualitative evidence rather than assumptions. So we want to hear from the individuals that are actually engaged in this work. We don't just want to assume, right? And the level of involvement of mine rescue personnel in my research is really significant. It is really about that equitable collaboration. I don't just want to have a box ticked off for participation. So I really want to kind of ensure that this research is not on OMR personnel, but it's research that's happening alongside them and with them. So they've really been involved in framing of the questions, and really through these interviews, they get to kind of reflect on their unique perspectives, teaching me about their experiences rather than me just asking questions. So I want these interviews to just kind of go wherever they can. Like I'm going to have certain questions that I want to get through, but I really want this to be a conversation that goes in a way that's really natural and really organic. And then I want to also commit to ensure that the findings from this research are fed into actionable recommendations for mental health policies or supports within the Ontario Mine Rescue Organization. And I know that myself, as well as the organization too, there's really this strong belief that if something is going to be created for this population, it really needs to be done through the voices as well as the comments that are made from this mine rescue community themselves. And I think for myself, having a great relationship with senior leadership in this organization has really helped me to be able to put this to fruition. And I'm very, very privileged to be able to play a role in which I can help not only some of my colleagues, but also the broader mine rescue community. And having them involved will help develop these insights into, what are the organizational strengths, but then also what are some opportunities for improvement in this current climate. In terms of approach, this is an interview-based qualitative study. So really, it means that we're focusing on depth and not necessarily numbers. So I'm going to be using a semi-structured interview process, which essentially means I've got a consistent set of questions that I'm going to ask everyone, but I can also follow what each person is saying. So in that regard, it's structured enough. We can compare it across participants, but it is also flexible enough to really capture those real experiences. And participants are going to be invited to share, what was it? What did support look like for you after an incident? We want to know, okay, what did you try? What didn't you try? What helped? What felt unhelpful? What made support accessible? And then also what got into the way? And then a big part of this project is that it's really designed to be usable. So I don't just want it to be something that's publishable. I want it to really have impact. So rather than me having designed this study alone, I'm building it with the input from people who know the mine rescue context. So I'm using an approach where the people and the organization who can actually use the results, they're engaged throughout the entire process and they help shape the study so that it's actually relevant and usable for them. And rather than me having designed the study alone, it's coming through the input of the people who know the mine rescue context. Now, that does not mean that they're going to control what participants say or how the findings are reported. There is still, that confidentiality as well as that research independent. That's going to come first. But it does mean that the study is shaped in a way that the findings are more likely to be relevant, they're more likely to be feasible, and in that regard, they're more likely to be implemented. And the goal really is that the results can just be fed back into real world improvements and not just sit on a digital shelf, right? On this slide, I'm just going to kind of summarize the study, 6 clear steps so that you can see how everything kind of connects from start all the way to finish. So, step one, what is it that we want to learn, right? Well, the focus is on supports after critical incidents, right? What helped, what didn't, and what people think should change to better support Ontario mine rescue personnel. And then step two, who are we talking to? Well, that's going to include Ontario mine rescue volunteers and staff that have relevant experience. And it's going to be a small group, maybe around 12 to 15 people, because again, this really is an in-depth interview study. It's not a survey. And these interviews are taking quite a while, some between 2 to 3 hours, but all of them to date have been 2 hours minimum. And then step three is how we're inviting people. So we're using targeted invites through social media, approved channels, and that's just really to kind of reach people who fit the study. And then there's also referrals. So participants can then share the invite with others who also fit the criteria. How will we connect the information? Well, this is through the confidential interviews. It's by Zoom. It can take place by phone. It could take place in person. And that's just really based on the participant's preference. And then importantly, again, that focus is going to be on the support. It's not going to be on the detailed incident stories. Step five is how we're going to make sense of this. Well, I'm going to look for patterns across the interviews. I'm going to organize them in what we call in research coding, and then we're going to build clear themes that really reflect what participants are actually describing. And then another little step that we're doing is we're actually going to go back to the participants. So we're going to see if our interpretation is correct. So rather than the researchers just making an assumption, we're going to go back and say, okay, am I understanding what you're saying? And they'll have an opportunity to review everything. They're going to receive a little bit of a summary of what was understood. And that's just kind of the step that we're taking to really ensure that this research is in the lens of these individuals. And then step six, how are we going to share the results? Well, names will be removed. The information is going to be stored securely. And then also a plain language summary and recommendations are going to be brought back to Ontario Mine Rescue so that the findings can be used in practice. So again, it's designed to produce practical, grounded recommendations that are based on these real experiences of what support looks like after critical incidents. And then this brings me to recruitment. So if you are a current Ontario Mine Rescue volunteer or staff member, you may be eligible to participate. Participation is going to involve a confidential interview. And like I previously said, it could be by Zoom, phone, in person. And we're going to focus on supports after incidents and not detailed retelling of the incident itself. Again, reminder, confidentiality central here. Your information's not going to be shared with your employer, and anything shared publicly is going to be combined into anonymous themes. So individuals, they're not going to be identified. And then there's also research ethics approval for this. So if you're interested, or unsure of what you've experienced counts as support, just reach out because if you've talked to someone or you've received help from the organization, there's likely a high probability that it counts as support. So, just to kind of wrap up here, there is that key message that the most effective support systems are the ones that people trust enough to actually use. And, this study really does aim to document that in a respectful and in a confidential way. And I really do want to know, what mine rescue personnel says works, what doesn't, what should change, because we really want post-incident supports to match the real needs of this people that are doing this brave altruistic work. So I want to thank everyone for their time. And if you or someone you know is eligible and open to participating, you can contact me at the email here, bbrohm@laurentian.ca. And I'm not sure how much time we have left, but happy to take any questions.
Awesome. Thank you. We do have one question here. So, with large mining companies, can you include the company OMR within all the provinces for the same company? We
Um,
have mines in Ontario, Manitoba, and Newfoundland.
Oh, for this, okay, sorry. For this specific research, we are just focusing on Ontario Mine Rescue. That's not to say in the future that there is not review of other provinces, but for this specific study, it's just pertaining to individuals in Ontario.
Okay, thank you. Are there any other questions?
And if something comes up for anyone as well that you want to ask, maybe after this, like feel free to send an email. Happy to respond to any questions pertaining to this research. And looking forward to sharing the results as well once we start with the data analysis.
Awesome. Yes, and if you're looking for any recruitment materials or things that you can share, please email Brianna directly, and then she can get you all of that information as soon as possible. Thank you.
Thanks.
Ooh, one more second. One
Yeah.
question from Tammy. Is a comparison going to be made with volunteer firefighters?
Not a compare like with respect to this research, the research is just predominantly focused on mine rescue. That's not to say that individuals cannot, review the parallels between the populations that are doing this work, but in this specific study, there's no comparison to other first responders. But what I will say is there's no research that actually exists pertaining to mine rescue. So all of the literature review that I had to do really did pertain to EMS and firefighters because this is the first research that's actually taking place. I believe there was one research study that exist based out of China for the mine rescue personnel, but nothing other than that that I could find.
Awesome. Yeah. So something we'll save for the discussion section of the research here.
Yeah.